Coming up in today's video, guys, I've got an interesting case to start with, which is one of mine, and then we've got Katie's, which is a big, thick pea, no, not big, a big, thick, sticky plug it is, actually. I couldn't remember what it was.
Big, thick pea?
There's probably that. So this first one now, this is actually a really, really interesting case, this one, because this was a really lovely gent that booked in, recently had some surgery, and has had a shunt fitted. Now, this one is something you don't come across very often, and if you don't know what a shunt is, basically, sometimes you can get a condition called hydrocephalus, which is where you get cerebrospinal fluid build up inside the sort of spaces around the brain, and it can actually put pressure on the brain. So to relieve that pressure, you have a shunt fitted. So it's like a little valve they put in. It's usually mounted around the mastoid bone. Oh wow! And it drains to your abdomen. You just absorb all the excess fluid. That's how it works, right? So there's two different types of shunts. There is kind of like there's actually the one you need to be most worried about is a PVP shunt from, I would say, but it has a little mechanical valve on the inside which can change the flow of this fluid, right? So we've got to be really careful. So in that kind of situation, you can only really use microsuction and manual tools. You can't use irrigation because it's classed as an ear surgery. You shouldn't really do irrigation on ear surgeries. And the other thing you've got to be super careful if you know anyone with a shunt is you can't do a hearing test with standard headphones because the magnet inside the headphone affects the valve on the inside. So you've got to be careful with that kind of stuff. Yeah, it's really interesting case. And it's something you don't come across too often. So just if you are an audiologist, earwax practitioner, you're doing hearing tests, or if you do come across with somebody with a shunt, if they don't know what type they were fitted with, because there's one that's got like a kind of like a standard valve, and there's another one that's got a mechanical valve that actually moves. Err on the side of caution. You can only use inserts to test that patient, and bone conduction must always be on the other side. Just a little bit of raise of awareness there. But having said that, lovely guy, really nice. And
just blocked up.
Just blocked up, just completely blocked up. Nothing untoward inside the ear canal, just really blocked up here. And you can see it is really kind of fighting me, this one. It did not want to come out easily, and I was trying to sort of keep it together as one big plug. But as much as I was trying to get this back section forward, it just wouldn't come. So I've got to go in with the right hook here.
It's quite a long plug as well, isn't it?
It is ridiculously long. And the lovely gent was going, he was quite concerned because he'd had obviously quite big surgery done recently, in the last couple of months, and he was worried, am I experiencing these hearing issues because of the surgery I'd had done? So when we actually managed to get this wax out, and he could hear so much better. He was really pleased. He was like, I can't believe it, that's so much better now. I was really worried I'd lost some of my hearing on the one side post-surgery. But really lovely guy. Oh, don't forget to stay tuned for the end, guys, for Comment Corner. We haven't changed the end yet, because you guys haven't come up with a better one. So it's still Comment Corner for the time being. There's actually 2 comments in there, because it was so popular. Loads of you had questions. So I thought, if I'm going to try and do one every week, it's going to take me months to get through them all. So I've done 2 on the subscribers videos coming up this week. So you've got 2 on this one, 2 on the next one as well. Quite good questions as well, someone coming up. Yeah, really interesting ones.
I actually had an interesting case today, actually.
Did you?
Jen came in for just an annual review, and has recently been having radiotherapy on sort of this portion of his head, and started randomly feeling really like a bit of discomfort. There was almost like pressure. He explained it in that side, and he said his hearing just completely went, but did come back. We tested him today, and it has dropped. It has been affected. It's damaged slightly. Yeah.
So they think that's as a consequence of the radiotherapy, or
it's quite likely. Yeah. His GP is like kind of was very sort of like almost 100% that it's the radiotherapy that kind of caused it. But yeah.
Can happen with very localized radiotherapy.
Yeah, especially in that area. That's like obviously around. Yeah,
you've got to be careful. We used to test when I worked in the NHS. We used to test people on a regular basis if they were on radiotherapy in that area as well.
Right.
I used to test quite regularly. So we're coming to the end of this video, guys. You can see really sticky, and you can really see why this just wasn't letting go. We've got this underlayer of skin, which I'm trying to lift up here. There's the bit we wanted to see. But it was just adhering to the canal wall all the way around.
It's crazy how much that little bit is like stuck there with it.
Or you might get just a little bit, it's just hooked onto the anterior recess. There's a little bump just at the front of the ear canal. And it just hooks on there and it just will not let go. But it's coming away really well. This is, it is quite sticky. I think Katie's plug that's coming up next is also a pretty sticky one as well. But yeah, chunky plug, that one.
Oh, nice and clear afterwards. Oh,
yeah, I was expecting quite a bit of staining around the outside. But considering that's one ear canal, what's that in inches? About an inch. Thereabouts.
2 centimetres.
There you go. Just under an inch probably. But yeah, that's a fair size. So this is actually Katie's. Now this is a difficult one because we've got quite a narrow canal here, and we've got these little hairs all coming around the outside edge, making it a little bit more difficult to see. But that bit.
Oh yeah, deep bit there.
Yeah, I think we do come away nice and clearly though on this one. There you go.
Oh, nice.
In fairness to Katie, she's doing fantastically well. She's doing really, really well. We don't get called in too often. I did get called in to help her out with one today, but everything else she's flying through at the minute.
Yeah.
And even that was a difficult one for me. It was a real kind of tough, deep piece of skin. It stuck to the eardrum and the anterior recess. Was a tough one to get out.
Yeah, thank you for checking on her as well, because I know a lot of you have been asking about Katie.
Yes. Yeah, and if you missed that, we did explain why she's not on the videos. It's on comments. Kind of go back over the last guy. I won't spoil it. I'll make you go back and watch it. Go back and why did you watch it? Go back and take a look at that one for me, guys. That'd be great. And don't forget, if you do enjoy the videos, you can always like, heart, share, follow, and subscribe. If you thoroughly enjoy the videos, you can also consider becoming members of the channel, and you get 2 extra videos every single week as well. So keep an eye out for that one, and all the details for that is in the description below. So go and take that one out. Take a look at that one as well. Crumbly.
Lots of little bits coming out in this
Very much so. Lots of teeny bits that are kind of sitting over the top of one another. Sometimes these can be difficult to do.
I was going to say, is that little layer of like almost like skin then?
You can see it lifting there, can't you, from the corner? There it is.
It's the problem you get when patients been using a lot of oil. It sticks to the hair, and then as soon as you start looking, it blocks it, like kind of mists up the camera a little bit. And when it gets quite deep like this, it's a bit of a tricky one. Oh, this is a messy one, isn't it?
It is. And it's one of those kind of slightly frustrating ones because you're going to have to go in a minimum of 3 times to get those bits out, because you can see they're very crumbly and they can almost block the suction tube every time. Now, I was intrigued. See this top left corner? When I edited this video, I was looking at it going, is that a bit of cotton wool or is that skin? And it's really hard.
Oh yeah.
That to me looks like cotton wool, or the end of a Q-tip, something like that. Yeah. Q-tips are a bad idea, guys. We've also done a video on that. You can take a look at one of those corners. I'll put a link to that as well. We did that last week, so all about Q-tips and what you should do to keep your ears clean. Really interesting video. Make sure you check that one out as well, guys. But that's coming away well. Really, really well.
Did a good job there.
She did.
Yeah,
she did.
Fair play.
Oh,
that's it.
Last little bit, just the hairs are catching on them as you're bringing the pieces out, but looking a lot better there. There's a ruler shot.
Ooh.
That bad
4 centimetres,
4 centimetres, I didn't know what that is in inches. Gonna give you a look. So guys, as promised, comments corner coming up. So the first one we have is from Gina Marie G10, who's also a member, but look at that as well. She's got a little member's badge there. Thank you very much. Do audiologists ever use dentist chairs in order to move patients around and reach certain, I can't quite read that, certain areas within the canal more effectively? Yes, we do. Lots of people use various different ones, and there is an element of personal preference, all right? Because we originally did loop training, we were tending to use more so like barber's chairs and things like that. So a chair that you can sit on, you can spin the patient around, just spin their ears, which the patient thoroughly enjoys, by the way, we get halfway through. So we use those. I have known people use dentist chairs. We did use a couch for a little while, but when we switched to an endoscope, it became a little bit more difficult to hold the endoscope close to somebody's ear. If you use an ENT microscope, you'll more than likely use a couch because you want that patient really, really still.
Yeah.
Yeah, so that answers that one. Do you want to take, is it unusual for one of you to have more wax than the other? From TJ-SU6ZI. I presume that's Susie with a 6. Yeah. There you go.
Is it unusual for one ear to have more wax than the other? It's not unusual. We see it quite regularly in clinic, actually.
Yep.
Yeah, I haven't really got anything else to say, really. No, it's not unusual.
It's not, and you'll get various different changes. You know, both ear canals won't be identical, so you'll have subtle changes in shape, size of one ear canal compared to the other. You might find that the skin in one ear canal is a little bit drier than the other, so you might find the wax behave slightly differently. So it does happen. You do see differences in people's ear canals, and we've even got it where they're completely blocked on one side and completely free on the other. So yeah, that does happen. Well, guys, keep those comments and questions coming, please. If you want to appear in comments corner, please think of a better name for that than I've come up with. Let us know in the comment section below, and we will hopefully feature your question up on the screen at the end of our videos on the subscribe videos. So as always, guys, in the meantime, take care of yourselves,
take care of your ears,
and take care of one another, and we'll see you for the next video. Bye, everybody.
Bye bye.